So it sounds like the work you're doing with the ICO and with Orbis is kind of fairly similar.
Sure, it's most of the stuff. Now that said, since I'm a neuro-ophthalmologist, usually whenever I go with Orbis, oh, you can do neuro too, or we'll go do something with the ICO and you can do some neuro-ophthalmology lectures too. So it's sort of they get two things for one, so to speak. But yeah, I'd say probably 2/3 of the traveling is probably medical education, and 1/3 is neuro-ophthalmology, just being invited to do neuro-op at other places, and then there's no medical education portion of it at all.
So how's your work different, the work you do with the International Joint Commission on Allied Health Personnel and Ophthalmology?
Yeah, so,
I had to rehearse that.
Yeah, IJCAHPO. So I've been working with JCAHPO for a long time. JCAHPO is a group that was the Joint Commission on Allied Health Personnel. So it's started in North America, U.S. and Canada, and AAO is one of the founding members. So the members of JCAHPO are organizations. So the North American Ophthalmology Society is a member. The American Academy is a member. AUPO is a member, and so on. So there's like 20 members. And the mission of IJCAHPO is to educate, train, certify, and accredit ophthalmic technicians, and to create a career for ophthalmic technicians, basically. So IJCAHPO has an arm that's education, and they have an arm that's certification, and really an arm that's accreditation. And the people who work in those arms usually don't mingle with one another. It's not good to be. So I've been the head of the education part of IJCAHPO. I've been the president of JCAHPO, and I'm now the secretary for international relations for JCAHPO. So the work I do with them is all about technicians, so ophthalmic assistants, technicians. The WHO term is Allied Ophthalmic Personnel, or AOP. So if we were going to rename JCAHPO, it would be Allied Ophthalmic Personnel. That's the term that WHO wants to use. And some years ago now, JCAHPO became IJCAHPO because we have international certificates. So technicians who've taken the tests and passed the standardized test internationally, and we're trying to grow that throughout the world because in some countries, there's no job description for allied ophthalmic personnel.
Right.
So, and in fact, my consulting with the WHO all came through allied ophthalmic personnel and human resources, because they realized it's not enough to have ophthalmologists in these countries. I mean, the ophthalmologists are checking visions and things that you don't need to be an ophthalmologist to do. Why are they checking visions? Because there's no allied ophthalmic personnel. So I think in general, people have pretty much realized around the world, you got to have the team to really be efficient. And so that's sort of what I'm trying to accomplish is we're working on a white paper to use with ministers of health to show how important allied ophthalmic personnel are and how cheap they are relative to doctors in terms of what you pay them and how much training they need. But in order to have a team and to be efficient, your doctors need them. So that's part of the WHO stuff. I've been a consultant there a couple of times, and I'm also on the Human Resources Committee for the IAPB, the International Association to Prevent Blindness, and we're working on a team training curriculum right now for that to try to reach that goal.
Who is it what organization did you just give that COVID-19 webinar through? Was that through IJCAHPO?
I did one for IJCAHPO and then one for Orbis. Almost the same, a little different. The audiences are a little different. And then I just, this past week, did a follow-up COVID one for IJCAHPO.